This video was made possible with the support of our Patreon members. Welcome and thank you for tuning in to Psychology Is. I am your host, Nick Fortino. I'm so excited to have with me today Dr. Joanna Moncrieff. Welcome, Dr. Moncrieff.
Thank you for having me.
You're welcome. I think our audience members are going to be very excited to see you as a guest for the second time. So Dr. Moncrieff, let me give you a proper introduction, is a professor at University College London and a consultant psychiatrist for the National Health Service. She's also founder, member, and co-chairperson of the Critical Psychiatry Network and a very successful researcher and author. Our first interview was published on January 14th of 2021. So it's been almost exactly 4 years since we last spoke. It was the 9th episode that you were on of the Psychology Is podcast, and this is now episode 72. Wow. So, and many of our episodes, since we last spoke have focused exactly on what you and I discussed in our first conversation, which was essentially what the public needs to know about psychiatry. Since our first interview, you've been busy.
I have.
Yes, indeed. You, and perhaps most notably, as many people are well aware, your massive umbrella review of the evidence related to the serotonin theory of depression, and that paper, which was published in 2022, garnered, as you put it, a storm of interest and became one of the most widely read and influential papers of modern times, ranking in the top 5% of all scientific papers ever written in terms of how many times it's been read, and in the top 1% since 2022. So what an incredibly, incredible success, although I mean, not that it wouldn't have been successful had it not got that attention, but anyway, just it made such a huge splash and has been so influential. So, congratulations on making such a big impact.
Thank you. I mean, I think those facts speak to why it was so important to do that research. There was so much interest because people didn't know. Many people hadn't even got an inkling that there was any doubt about the idea that serotonin and serotonin deficiency causes depression. People thought it was an established fact, whereas actually, the evidence has never been convincing, at least not for the last few decades since people have really been researching it properly.
Mm. And this extreme interest in your paper sparked you to write your new book, Chemically Imbalanced: The Making and Unmaking of the Serotonin Myth. And all the testimonies about it are just, use the strongest language possible. For example, James Davies wrote, "The most important health book written in decades. This book should be read by all psychiatrists and physicians with depressed patients," and many other, extremely positive testimonies.
And again, I think that speaks to the fact that there's a lot of interest because a lot of people are taking antidepressants. Mm. So it really is a very important subject.
That's a good point. Yes, it is directly relevant to millions and millions of people. And if it's not obvious, the reason that it's so significant that we have kind of exposed the lack of evidence to support the serotonin theory of depression is because the serotonin theory is the principal justification of the use of antidepressants. And if I may, I've copied, of course, the conclusion of that study. So I'll read that just so people have some context, and then I'll ask you to give just a brief summary of what that study entailed before we dive into the book. So the conclusion I'll read, you wrote, "The main areas of serotonin research provide no consistent evidence of there being an association between serotonin and depression, and no support for the hypothesis that depression is caused by lower serotonin activity or concentrations. And then you add that some evidence was consistent with the possibility that long-term antidepressant use reduces serotonin concentration. So can you give us a sense for people who don't know, what did this study entail?
So what we did was we got together all the research that's been done over the last few decades into possible links between serotonin and depression. So that question has been looked at in a number of different ways. For example, people have measured serotonin levels in the blood and plasma. You can't measure serotonin directly in the brain in human beings for obvious reasons. You can't stick needles into people's brains, but you can measure the levels of a metabolite of serotonin in the cerebrospinal fluid. So that's another sort of study that's been done, measuring levels of that metabolite in people who are depressed and comparing them to people who are not depressed. And then people have also looked at various serotonin receptors. They've looked at the serotonin transporter protein, which is what antidepressants, particularly SSRIs, affect. They've looked at the gene for the serotonin transporter protein. And then also there've been a collection of slightly odd experiments where people have been given a drink that is thought to deplete the brain of serotonin by depriving the brain of the amino acid from which serotonin is made. Those are called tryptophan depletion studies. And the idea of those studies is that they've been done in volunteers without depression. And the idea was that giving people this drink would lower their brain serotonin and lead them to become depressed or to have a lowering of mood. So we got together the research in all these different areas. And basically we found that in none of the areas was there a consistent pattern of a relationship between a serotonin abnormalities, either increased or decreased serotonin and depression. Of course, there were some studies that showed in some areas that showed that depression might be associated with low or sometimes high serotonin levels, but overall there was no pattern of effect. So, for example, there was no difference between people with depression and people without depression in terms of their levels of serotonin in the blood or serotonin in the or the serotonin metabolite breakdown product in the cerebrospinal fluid. The studies of serotonin in the blood or in the plasma were it consisted of a meta-analysis of 3 quite large studies. I should say, sorry, that because there's been so much research in this area, we didn't look at every single study individually. We looked at other reviews and meta-analyses of studies in each area. And that's why it's called an umbrella review. That's what an umbrella review consists of. So when we looked at the studies of levels of serotonin in plasma, we found that there was no effect of having depression, but there was an effect of taking antidepressants. So people who were taking antidepressants, whether or not they were depressed or not, showed lower levels of serotonin, whereas people who were depressed but not taking antidepressants did not show any difference in their serotonin
Groundbreaking
from
finding.
people who weren't depressed. So and weren't using antidepressants. So and in fact, that finding that serotonin levels are lower in the blood of people who are using antidepressants long term has been found in other studies as well. So that was a complete surprise to me. I didn't know that we'd find that. So that's why I made that's one of the bits of evidence on which that comment about antidepressants was based. And the other area of evidence that was interesting was the genetic studies, because of the fact that some of the early genetic studies suggested that there might be a link between the gene for the serotonin transporter and having depression. And then people suggested that maybe it wasn't just having the gene, maybe it was an interaction between having the gene and having adverse life events or being the victim of abuse or maltreatment in childhood. And so several studies came out suggesting that there might be this interaction effect. It was very clear that the larger, more modern, higher quality studies found no effect either of the gene or of an interaction between having the gene and having adverse events. But there was a very strong relationship between having adverse events and depression. So that research was interesting, both because it showed this link between adverse events and depression, but also because it showed how a research area can start off by showing some positive findings, and then gradually, as the studies get bigger and better, it turns out that those positive findings were spurious. Maybe it was some publication bias or something that led to them. So that was the results of our serotonin review. As you said, it sparked a lot of interest among the general public. Lots of people were really shocked because they thought, most members of the public thought that a link between serotonin and depression had been established. They weren't aware that it was just a theory that might have a bit of evidence but might not. They thought it was an established fact. And by getting all this evidence together in one place, we were able to show that it's really not an established fact.
And I think I appreciate you clarifying for people what an umbrella review is. It's kind of the bird's eye view of bird's eye views. It's kind of meta. And that's what we need. We need that perspective to see the broadest level of the literature to draw these conclusions. We need to compile massive amounts of data. So I appreciate so much that you and your co-researchers did this. So I'll read, there was right in the preface of your book, you wrote that for decades, people have been told, as you were just saying, that depression is a biological condition and that antidepressants work and save lives, as if these are indisputable facts. They are not, you write. And you write, as I show in this book, these beliefs are part of a myth, one that was constructed and is maintained to further various vested interests and bears little resemblance to the scientific reality. And so one of my questions, especially as we consider how much pushback is an understatement. I mean, how the extreme resistance that you were met with upon publishing this, that leads me to the question, who are these vested interests that benefit from the myth of the chemical imbalance?
Very good question. So, of course, the pharmaceutical industry has done very well out of this idea. And the pharmaceutical industry are primarily responsible for having inculcated it into popular belief, having persuaded us all that this is, a real fact. But the pharmaceutical industry are not terribly invested in antidepressants anymore. Most of them are now off patent and not being heavily advertised or promoted. They've moved on to other conditions. So what's becoming apparent now is that the people who want to defend this myth are a section of the psychiatric profession who want people to believe that depression is a biological condition. They probably have good intentions. I'm sure they think that's, I'm sure they believe that is the case. But what really concerns me is that they don't really want people to know the poor state of the evidence to support that idea. They don't want people to know that actually there's very little evidence to support that idea. And in fact, one could say really no good, strong supporting evidence for the idea that depression is a biological condition. And it seemed to me, certainly with the pushback that I got after the book, that what some psychiatrists were trying to do was to shut down debate about the nature of depression. So